So hi everyone, welcome to this Researcher Spotlight with Dr. Ie-Ming Shih. He's joining us today to discuss with us his research. So Dr. Shih, could you please introduce yourself to us?
Sure, it's my pleasure. My name is Ie-Ming Shih, and I came from Johns Hopkins University School of Medicine. And my field of research is gynecology disorders, including endometriosis, adenomyosis, and ovarian and endometrial cancer. I have been at Hopkins for more than 26 years.
Wow.
This year, yes, time flies.
Time flies, yes. Thank you so much for joining us today and making the time to discuss your work with us. So first off, I'd like to ask you, what inspired you to conduct research on endometriosis?
Well, that's a very good question. So by training, I'm a gynecology pathologist and also a cancer researcher working in the lab for almost 20 years. And as you know, as a pathologist, I encounter so many cases of endometriosis and adenomyosis. But I think the fundamental and the high impact research in this field was very scarce in the literature. So on the other hand, I'm also a lab scientist working on understanding how ovarian and endometrial cancer develop and how we can develop a technology for their early detection and a new drug combination to treat women with ovarian and endometrial cancer. So in our cancer research laboratory, we are equipped with state-of-the-art equipment and the technology. And so it comes to my mind why we cannot apply our cancer research tool to understand endometriosis and adenomyosis. And I think this is where I jump into this research field from cancer side.
That's wonderful. And I noticed you said that there's a lack of this high impact research. And I know that you've been one of the researchers now contributing to that high impact research. So that is amazing. I would just like to talk about that research and especially the project related to the grant that you received from EndoFound.
Sure. So we are very lucky and to receive this Endometriosis Foundation grant in 2018. Actually, we received several grants from EFA, so we really appreciate the foundation and all the donors to try to making this effort to help researchers. So in this interview, I just want to tell you something about the grant funded in 2018. And the project title is Gene Mutation Pattern in Endometriosis and its relationships with non-neoplastic endometrium and adenomyosis. So basically, the project overview is very simple. We try to determine the somatic gene mutations among endometriosis, adenomyosis, and the so-called normal eutopic endometrium inside the uterus. So the results would be critical to provide new evidence of the clonal relationship among the eutopic and the ectopic endometrium, meaning endometriosis.
So could you tell us a bit about your project findings?
So the major project finding is we try to focus on the DIE, so-called. DIE stands for deep-infiltrating endometriosis. That means that endometriotic tissues occur in very deep into the organs and like muscle layers of the urinary bladder or colon or diaphragm, which is the most severe form of endometriosis and usually cause very terrible symptoms and signs, and also is highly associated with infertility. So basically, that's our project focus. And what we found is that endometriosis deep into these muscular layers of organs, DIE, they are clonal in their development, meaning they can come in from the one stem cells that develop to this glandular component inside this endometriosis. Then the stromal cells home to this endometriotic foci and make a full-blown endometriosis that will give the patient inflammation and all kind of pain symptoms and systemic effect, etc. So that's our major finding, is to show that this DIE, deep infiltrating endometriosis, is actually coming from the single stem cell circulating in our body. And this is quite, I think it's quite exciting from the perspective of biology, and also it has this translational implication. For example, in the future, maybe we can use the blood test to identify this circulating endometriosis stem cells for the diagnosis and for other predicted medicine. How can we better manage women with deep infiltrating endometriosis?
Wonderful. So it seems like, I mean, it's very promising, right, to see how the research translates, can translate into better treatments and diagnosis for endometriosis patients. I'd like to ask you also a little bit about where you are with the project now and what the impact of EndoFound's grant has been for you and your team.
And so where we are about this project, basically this 2018 EFA grants has been completed, and we have published a paper in New England Journal of Medicine in 2018. And currently we continue the research duration as supported by NIH. Again, I just said that this is our preliminary result, and we are still far away to reach our goal to help the women with endometriosis. So that's why we need additional funding to be fully engaged for this research direction. So as I mentioned to you, the NIH grant we received totaling approximately $3.5 million. And this project starts from the 2019 and will continue for next 5 years. So hopefully we start from this EFA grant, and we are into the NIH funding because of this EFA support, and we will be able to continue on our research. So basically the importance of this grant is that we can really appreciate this kind of support from EFA to generate the critical preliminary results in order for us to compete for NIH grant to study further about endometriosis. So EFA basically provides this kind of seed fund and for us to generate the preliminary results. And we are really excited about our preliminary results, and so we write a grant in collaboration with other institutions to make a team. And finally, we are very lucky and successfully we received the grant from the NIH. And hopefully we can come up with something that really tangible, and we can help people with endometriosis, either for the early detection, diagnosis, and the personalized medicine for treatment.
Thank you, Dr. Shih. I think we're really grateful to you for conducting this research and the rest of the research team. And it's so wonderful to hear the progress that you've made. It's truly a delight for us to hear this. And I think your example goes to show how important it is to have these seed funding to then make progress and to obtain larger grants from the NIH. And how that really can later translate to better diagnostics for patients and better treatments for patients. Wonderful, thank you. So I want to move on from the grant and also just ask you what excites you most about the research that you're conducting.
So I think the most exciting thing for me to study endometriosis is endometriosis, in fact, is a really an enigmatic disease. And the new technology and the research concept will start unveiling its pathogenesis hidden from all of us for a long time. So I think it's a time that we apply the new technologies that we learn from cancer research field and to look into what happened to endometriosis. I don't mean that endometriosis is a cancer, but I think the same principle of research and the concept, I think it's all can be applicable to study these benign diseases. So that's why I make it my research in endometriosis so exciting. And I just cannot stop working on endometriosis study except this COVID-19 period of time. Yeah.
Yeah, it's definitely a challenging time, I think, for all researchers who need to go into lab and work in labs. So we're hoping that, you know, life gets back to normal soon. So another question I have is, what have you found most challenging about research on endometriosis?
Yeah, there are many challenging tasks in endometriosis study. And personally, I think the lack of convenient animal models of endometriosis is a major hurdle. Why I say that is because like in cancer research, we have different types of mouse model to simulate human cancer development. So we can give the mice the new treatment to see how it affects the cancer growth and how can we translate the research back to the human, right? But in endometriosis, mouse did not have this spontaneous endometriosis. So we don't have really good convenient mouse model to model the disease. Then we need to go to primate, but this is a different ballgame because it's so costly and there's many regulatory issues ahead. So I believe that we don't have the animal model is the most research hurdle we are facing in the endometriosis studies.
And what do you think is a way to solve that?
I think the alternative is we can do the 3D culture from the human tissues and so-called organoid culture. That means that we isolate the cells from the endometriosis tissues and also the normal endometrium from the women. Then we can use in the petri dish to culture these cells and to make a piece of human-like endometrium. And I think that can be the very good alternative to mouse models. And that's the way we are going to propose in the future grant applications. And I believe that the results from the organoid and the 3D culture systems will give us more insight into how endometriosis develop and how can we design a better drugs for the endometriosis disease and adenomyosis as well. And so I think that 3D model can be a technical gateway for the drug screening as well. So I think there's many things we can do beside the mouse model.
Well, it's good to hear that we have these alternatives.
Yes.
Yeah. So lastly, I'd just like to ask you, what additional research do you feel needs to be conducted on endometriosis?
I think the most important thing is how can we help the patient to alleviate their symptoms. And we know that endometriosis is a chronic inflammatory disease, just like your joint pain and many other chronic diseases. And how can we have a different way to combine treatments for the most benefit of the patients is the future duration. And on the top of that, we need to know which patients that we can treat with a unique way. So meaning that not every endometriotic patients will be treated equally. I think there must be some different types of endometriosis, although we just put as a one basket endometriosis. But we believe there are many different endometriotic diseases in women. And that's why the molecular genetic studies and our research will delineate how can we use this kind of molecular profile to help personalize therapy in endometriosis.
Yeah, and I think your answer shows that we still have a long way to go and a lot to do to provide the best treatment for patients.
Right. Maybe I can say the final word.
Yes.
Again, on the behalf of this endometriosis team at Hopkins. And so I would like to express my sincere gratitude for the EFA and the many donors who help our research in fighting endometriosis and help train the new scientists who will be devoted into endometriosis research in the near future. Thank you so much.
And thank you too for all the work you're doing. And we know you're also training scientists, so thank you for doing that too.
My pleasure. Thank you for having me today.
Thanks.